Hi there, my name is Christina Diacetis. The topic of my presentation today will be on arthritis and how it can be addressed through the principles of exercise physiology. I will be talking about the etiology of arthritis, the exercise concepts, nutritional information, how it plays a role in physical therapy, and provide 2 articles with statistics. So arthritis. We should just think of it as wrinkles on the inside. Just as we age externally, we also age internally. There are 2 types of arthritis. The first one is osteoarthritis, known as OA, and then there's rheumatoid arthritis, known as RA. OA is wear and tear of the joint's cartilage, and it's also known as degenerative joint disease. Some risk factors are obesity, age, injury or overuse, gender, it's more prevalent in women than in men, and race. Rheumatoid arthritis is an autoimmune disease, and it mostly affects our hands and our feet. The immune system attacks healthy cells in the body and causes inflammation into the affected body parts. Risk factors of RA is obesity, age, genetics, gender, again, it's more prevalent in women than in men, and smoking. Moving on to some exercise concepts. Energy systems. Fatigue is related to the increased cardiac and ventilatory system due to poor gait mechanics. So with that being said, if individuals who have RA have pain or joint dysfunction, they're going to have poor gait mechanics, which then is going to increase those systems. The exchange of potential energy and kinetic energy, which is associated with changes in timing and magnitude of the center of mass energy, can fluctuate, which then can be influenced by walking speed, joint motion, and footfall timing. Queen, Sparling, and Schmidt, 2016. Some energy transfer concepts. OA in the hip, knee, or ankle reduces effective exchange of potential kinetic energy. It reduces the effective exchange of potential and kinetic energy, potentially increasing the muscular work required to control movements of the center of mass. McConnell, 2014. Some exercise training concepts. We want these individuals who have arthritis to perform flexibility exercises. One that's really great for people with arthritis is dynamic flexibility, because it takes the joint within the full range of motion and it's loading those muscles and the joints. Another aspect for these patients who have arthritis is the more motion, the better. Motion is lotion. And just as anyone who's starting out an exercise program, you want to start off with a low dosing. And then these individuals also benefit the most from low impact activities such as cycling, walking, swimming, or water aerobics. Some fit concepts is you want these patients to perform resistance training and aerobic exercises. So for the resistance training, you want them to perform 2 to 3 days a week at light to moderate intensity. So if they can perform 10 to 15 reps with their weight or the resistance, then that's the light to moderate intensity. And then you want them to perform 10 to 15 reps with 5 to 6 exercises. For the aerobic exercise, you want them to perform that 4 to 5 days a week at a moderate intensity. So if they can't monitor their heart rate, a talk test is a great way for them to monitor that. So if they're doing their activity and they're able to talk but they can't sing, then that's at that moderate intensity. And you want them to do this for 30 to 60 minutes a day. Performing activities that individuals like is also a great thing to implement into any exercise program. If the patient doesn't like the bike, don't make the patient ride the bike, because then they won't perform it, and that's gonna discourage them and not improve their quality of life. Find activities, individualize each exercise program for the individual. That's from Mercado 2014. Muscle weakness has been identified as a risk factor for developing the development of osteoarthritis. Resistance training may reduce the chance of developing musculoskeletal disorders and reduce symptoms of pain and disability. Garber, 2011. Now we're going to talk about some nutritional information. If your patient has a high-fat diet, this can result in fatigue, feeling lethargic, and increased rates of perceived exertion during their training sessions. So if you're seeing these symptoms and you're not sure why, especially if they've been training for over a month, then definitely inquire into their dietary habits and give them that education. If you begin a moderate training program, 55 to 60% of your calories should come from unrefined carbohydrates. Marcottle, 2014. Foods like fiber-rich grains, fruits, and uncooked vegetables are good sources of the unrefined carbohydrates. An article I found also talked about how the Mediterranean diet is great for individuals with arthritis. It helps decrease inflammation, it benefits your joints and also your heart. It leads to weight loss, which then can lessen the joint pain. Partottle, no date. So the role of physical therapy with arthritis, our goals for these patients is to improve motor control, muscle strength, joint mobility and flexibility, and improve functional skills and activities. The main goal for these patients is just to keep them moving. The more they move, the better they'll feel. Some key points is arthritis can be managed with specific exercise programs such as aerobic exercises and resistance training. Quality of diet, consisting of unrefined carbohydrates and low impact activities are the best options for these patients with arthritis. 54 million Americans have arthritis. Let's continue to guide them so they can achieve their goals and be successful. Thank you. Let me know if you have any questions.